Seeing blood after using the toilet can be very alarming. Some people notice bright red blood on the tissue paper, others see blood mixed with their stool, and some people notice very dark or black stool. Many people quickly assume it is just piles and decide to ignore it. But this can be a dangerous mistake. Blood in your stool is not always caused by piles. In some cases, it can be a warning sign that something serious is happening inside your digestive system. Ignoring this symptom could delay diagnosis and treatment, allowing a medical condition to become worse over time. So in this video, we're going to talk about what blood in stool really means, the common causes, warning signs you should never ignore, and when you should seek medical help immediately. First, let us understand what blood in stool actually means. Blood in stool simply means that there is bleeding somewhere along the digestive tract. The digestive tract includes the esophagus, stomach, small intestine, large intestine, rectum, and anus. Bleeding can occur anywhere along this pathway, and sometimes the appearance of the blood can give clues about where the bleeding is coming from. Bright red blood usually suggests that the bleeding is coming from the lower part of the digestive system, especially the rectum or anus. Dark red blood may suggest bleeding from the colon or deeper parts of the intestine. Black or tar-like stool often indicates bleeding from higher up in the digestive system, such as the stomach or small intestine. This happens because the blood becomes digested as it passes through the intestine, which changes its color. Now let us talk about some of the most common causes of blood in stool. One of the most common causes is hemorrhoids, also known as piles. Hemorrhoids are swollen veins around the anus that can bleed during bowel movements. This usually happens when a person strains during defecation, especially when constipation is present. People with hemorrhoids may notice bright red blood on toilet paper or in the toilet bowl after passing stool. Another common cause is anal fissure. An anal fissure is a small tear in the skin around the anus. This often occurs when a person passes very hard stool. This tear can cause sharp pain during bowel movement and may also lead to bright red bleeding. Constipation is one of the major reasons anal fissures occur because hard stool stretches the skin around the anus. Infections of the intestine can also cause bleeding. Certain bacterial infections or severe inflammation of the intestinal lining can irritate the bowel and lead to blood appearing in stool. In some cases, severe diarrhea or infections that affect the intestines may cause bleeding as well. Another important cause is stomach ulcer. When an ulcer in the stomach or upper intestine begins to bleed, it may lead to black stool or very dark stool. This type of bleeding may not always be noticed immediately. Over time, a person may begin to feel weak, dizzy, or tired due to blood loss. Polyps in the colon can also cause blood in stool. Polyps are small, abnormal growths that develop in the lining of the intestine. Some polyps may bleed occasionally, which can cause blood to appear in stool. Although many polyps are not dangerous, some of them may develop into more serious diseases if they are not detected early. Now let us talk about some of the symptoms that may appear along with blood in stool. Some people may experience abdominal pain or discomfort. Others may notice a change in their bowel habits, such as persistent diarrhea or constipation. Some people may feel weak, dizzy, or unusually tired if bleeding has been occurring for a long time. Loss of appetite and unexplained weight loss may also occur in certain situations. It is very important to understand that even though piles are a common cause of bleeding, not every case of blood in stool is caused by piles. Assuming that it is piles without proper evaluation may delay the diagnosis of a more serious condition. Now let us talk about warning signs that should never be ignored. If you notice a large amount of blood in stool, black or tar-like stool, severe abdominal pain, dizziness, fainting, persistent vomiting, or unexplained weight loss, you should seek medical attention immediately. These symptoms may indicate significant bleeding or another serious condition that requires urgent medical evaluation. Another warning sign is persistent bleeding that continues for several days or weeks. Even if the bleeding appears small, it is still important to seek medical advice so the underlying cause can be identified. Doctors may perform several tests to determine the source of bleeding. These may include stool tests, blood tests, imaging studies, or procedures that allow doctors to examine the digestive tract more closely. The good news is that many causes of blood in stool can be treated effectively once the correct diagnosis is made. Preventing constipation can also reduce some of the common causes of bleeding. Eating enough fiber from fruits, vegetables, beans, and whole grains helps keep stool soft and easier to pass. Drinking enough water also helps prevent hard stool that can lead to straining. Regular physical activity can also help maintain healthy bowel movements. Listening to your body and not ignoring the urge to use the toilet can also reduce the risk of constipation and straining. In summary, blood in stool is a symptom that should never be ignored. Although it may sometimes be caused by piles or minor conditions, it can also be a warning sign of more serious problems in the digestive system. Understanding the possible causes and recognizing the warning signs can help you seek medical care early and prevent complications. Taking care of your digestive health is an important part of maintaining overall well-being. If you found this video helpful, make sure you like this video, share it with others, and subscribe for more health topics.